Assalamu alaikum students. I hope you all are well. This is the last topic of trace minerals in which today's we will discuss copper, fluoride, their food sources, deficiencies, toxicity, absorption, transport and storage sites. In next lecture we will discuss water. Zinc is one of the important trace mineral. It is a part of the 25 more than 25 enzymes involved in digestion and metabolism, component of the insulin, essential in the synthesis of the nucleic acid and formation of the different proteins in the cell, and it is essential for the growth, wound healing, metabolism of the vitamin A within the body. Zinc absorption is take place in the small intestine, and if the level of the zinc is high in the body, so the mucosa blocks the absorption of the zinc. But if the low level of the zinc, then opposite function, it allows the mucosal allows the absorption of the iron. So sometimes due to the zinc supplement or the overdoses of the zinc, it affect the mucosal blocker, or there are no site for the storage of the zinc. So main body maintains the exchangeable pool of the zinc in the liver, bone, pancreas, kidneys, and blood. That allows the body to recycle zinc and maintain the zinc status when intake is low. And if the excessive intake, then it is excreted through feces or decreases the risk of the toxicity. Zinc deficiencies. If the low intake of the zinc or then decrease the appetite, taste, delay in growth, or poor wound healing, impair the immunity or the immune responses, anemia. These are the symptoms of the zinc deficiencies. And if the overconsumption of the zinc, then it causes the nausea, vomiting. In case of zinc deficiency, cramps and diarrhea is also common. Selenium is an antioxidant that appears to preserve the elasticity of the tissue by delaying the oxidation of the polyunsaturated fatty acid. it supports in immune system. Selenium absorption is take place in small intestine and it is bound with two amino acids. Selenium absorption is not affected by selenium stores and its balance is achieved through its removal from the body. In case of the selenium deficiency, there is no specific disease. The disease that is associated with selenium deficiency is Cashin disease, in which cardiomyopathy or affect the function of heart. And in case of selenium toxicity, if the excessive supplementation of the selenium, then it causes the diarrhea, nausea, vomiting, cramps. Copper is one of the trace mineral and basically essential component of several enzymes help in formation of hemoglobin, transport of iron to bone marrow. Basically, marrow is a soft tissue in bone center for the formation of the blood cell party, and it also participate in energy production. Copper absorption is take place in small intestine like zinc. Copper is also absorbed by simple diffusion, active transport, uh, and transfer or transported out of the mucosal cell into the bloodstream. Copper is bound or with albumin or other protein and rapidly moves to the liver. Copper is almost found in all tissue, but the heaviest concentration or the more found in the liver. Copper deficiency is rare among the adults, mostly deficiency of the copper in premature infants, in case of the malabsorption or protein energy malnutrition. People on the long-term NG feeding or the copper deficiency is basically caused by taking the excessive zinc supplement. In case of if the person is taking zinc supplement, then in case of the copper toxicity, the Wilson disease occur or the hepatoglandular degeneration. Basically, Wilson disease is a genetic disorder. It mostly affects the brain and liver, and the symptoms of the toxicity is nausea, vomiting, or abdominal pain, diarrhea. If any person is consuming too much zinc or taking zinc supplements, then deficiency of the copper is occur, and the symptom of the copper deficiency is anemia, impaired growth, and bone mineralization. Fluoride is a basically ionic form of the fluorine, and it is not a too much essential nutrient. All the body function can occur without it. And fluoride basically increases the resistance, more resistance to the dental caries, and it strengthens the bones teeth by making the bone mineral less soluble. The absorption of the dietary fluoride is take place in stomach, small intestine via passive diffusion. 80 to 90% of the dietary fluoride we consume is absorbed, and absorbed fluoride is transported via bloodstream to bones, teeth, and the amount of absorbed fluoride deposition is in teeth and bone is greater during in kids more fluoride is deposited. In case of the fluoride deficiency, it increases the teeth decay, and if the excessive amount of the fluoride in drinking water, then it causes the permanent discoloration in children teeth. Chromium is associated with lipid and glucose metabolism. If eating the refined sugar, then it causes the depletion of the body chromium level. Very little chromium is absorbed from the dietary sources. Once the absorption of the chromium is take place, then it is transported by a transparent via the bloodstream, and it accumulate or store in the bones, liver, kidneys, spleen, and concentration of the chromium in human tissues are very low. Its level is decreases with the age. Concentration in human tissues are very low because of the most of the dietary chromium is removed from the body through feces. Its deficiencies appear if the disturbance in glucose metabolism. If the any issue in glucose metabolism, then its deficiencies occur.